Thank you so much, Johanna. And as you said, my job is probably the hardest one, not only because of the topic, but also because to keep you engaged as the last speaker. So I want to start with some statistics. I know most of you are familiar with all of these statistics, but I thought it would be important to remind us of the challenge that we face to put the topic in the context. So, we're going to have 10,000 people celebrating their 65th birthday every day till 2000 for the next 20 years. And in 2030, 1 of every 5 Americans will be older, will be considered older, or about 72 million people. And this is not just a problem in the Western countries. This is a global problem, and as you can see, compared to 2014, the red and the dark pinks are, as you can see, 25 or 29% of the population, and the red is 30%. So you can see that this phenomenon is a global phenomenon, and it's going to be observed everywhere. And with that, of course, as you had heard throughout the morning, comes all of the different diseases that are associated with aging, and as you can see, the healthcare costs associated with them is pretty extensive. I like this slide because it just puts things in context that the cost of dealing with Alzheimer is twice as much of the revenue of Walmart, which is the largest revenue-producing company in the world. So you can see the extent of the problem that we would need to tackle with. So therefore, developing strategies that would increase the health span or the years of successful aging for the older adults becomes pretty critical, not only at the personal level, but socially and economically. And the good news is that, contrary to the older belief that the aging process and the age-associated diseases are mostly genetically controlled, we now know that the environmental factor, lifestyle factors have a significant impact in terms of how we age and how soon we age and how do we live the later years of our life. And but the key in order to, having this flexibility and the aging not being an inevitable, intrinsically controlled process entirely, leaves us with the ability to develop strategies to live healthier lives for the older adults or develop healthier lives. But of course, the main challenge in trying to develop these strategies, as has been mentioned before, is to try to define what do we mean by healthy aging or successful aging. There's even disagreement about what do we call it? Do we call it healthy aging? Do we call it successful aging? Do we call it, living well? Or, there's all sorts of controversies related to that. And as you will hear throughout the presentation, there's really not too much consensus on how to define healthy aging or what are some of the essential components of it. We are reaching some agreements as the science has evolved, but we still don't have one final definition that would say, what is healthy aging. So what I like to do in the remainder of my talk is to review with you some of the definitions that have been proposed and what are some of their shortcomings and also what are some of the important components of them. So the definition of successful aging has been around for many years and it's been evolving. It has really evolved from a definition of where the focus was on lack of diseases or negative attributes when it first started, to one that says, aging successfully is not the same as not having diseases. It goes beyond that, and I think that's an important shift in terms of focusing on some of the positive attributes rather than only on lack of diseases. So this really started very much by the very seminal paper that Rowe and Kahn published in 1987 in Science based on their studies in the MacArthur Research Network of Successful Aging, where they said that they described successful aging as involving freedom from disability along with high cognitive, physical, and social functioning. So they took the focus away from just being on lack of diseases. And they categorized this successful aging into 3 different domains in a way. One was freedom from diseases and disabilities, as before. The other was having high cognitive and physical functioning. And the third one was social and productive engagement. And in their later publication, they added resilience, which is the ability to adapt to the change and being able to deal with some of the unforeseen problems. And you'll see this theme coming through in the later definitions that of healthy and successful aging. And they, in their research, they identified certain modifiable factors, and these are the ones that I've listed here. They thought modifiable factors that could influence healthy aging were carbohydrate metabolism, osteoporosis, cognitive function, psychological factors, as well as support and control, bereavement and relocation. And of course, there's controversy in all of them, but these are one of the first times that other non-biological factors are surfacing out as being important in terms of successful aging. NIA and White House Conference on Aging and WHO have all emphasized that healthy aging goes beyond absence of disease and disability. And CDC has defined healthy aging as development and maintenance of optimal physical, mental, and social well-being and function in older adults. And Health Canada has expanded the definition of healthy aging and described it as a lifelong process of optimizing opportunities for improving and preserving health and physical, social, and mental wellness, independence, quality of life, and enhancing successful life course transitions. Now you can see how it becomes then difficult to try to quantify all of these. I mean, these are all very important, and of course, as you'll see, it's something that the older adults themselves care very much about, but in terms of objectively assessing them, it might become a little bit of a problem. And of course, there are others who have described aging as degree to which elderly individuals would adapt to age-associated changes or view themselves as successfully aging or are morbidity-free until the time that they die. Now, I want to show you a couple of results from a couple of studies where they have tried to use this definition and come up with the percentage of either successful aging or find what are the important attributes of successful aging. So one study that was published recently is by Tyrovolas et al. That they evaluated determinants of successful aging together with assessment of dietary habits, and that's one of the first studies that has included dietary habits in relation to healthcare facility use among the older adults that are living in that live in the Mediterranean basin. And they looked at a total of 2,663 elderly people, age of 65 to 100 from 21 different Mediterranean islands and so forth. And the way they described their successful aging was to break it into 3 different domains. Again, similar to what you had seen before, low probability of diseases, high cognitive and physical function, and then active participation in social activities. And their belief was that looking at multi-domain approaches to successful aging would be a better predictor of successful aging rather than focusing on one component of this whole scheme. And then they came up with a 10-point index of successful aging and gave them then ranges from 0 to 10. And these are some of the different points that they include: the education, financial status. I mean, they basically, in a way, these 10 points are broken down into lifestyle factors such as adherence to Mediterranean diet, frequency of physical activity, biological factor like BMI, cardiovascular disease risk factor, depression, and then social participation, as you can see here, and also some of the demographic backgrounds. So what they found was that the higher a score of successful aging based on that 10-point scale was associated with less use of healthcare services. And it came up with a value that a 1/10 unit increase in the successful aging index was associated with about 0.8 less times a person used healthcare facilities or sought consultation with a physician. So to try to sort of correlate and say that this 10-point index had some correlation with healthcare outcomes for the older people. What you can see here is they then took their 3 domains and tried to see how strongly they're associated with successful aging. And as you can see, they put it into psychosocial, economic factors, clinical characteristics, and then lifestyle characteristics. And this is a busy table, but I think if you look at the cumulative variance that is explained for the healthy aging by each of these factors, you can see that 23% are explained by psychosocial and economic factors, 38% by clinical characteristics, cardiovascular risk factor and body mass index, and a very large portion, 48%, is explained by lifestyle factors such as a frequency of physical activity and the Mediterranean diet. Another study that tried to sort of look at the percent of successful agers, in order to do that, they conducted a literature search from all the published studies in English that had used the word successful aging or healthy aging in people who were over the age of 60. And then they categorized their component of their definition and then looked at its relationship with some of the, with successful aging. And their purpose was to try to find out what percent of older adults are living successfully. But in order to do that, they did the literature search and came up with 28 papers that had used definitions that they had predefined and was conducted in people that were over the age of 60 and also had some baseline variables that were measured that they could then contribute and make a connection with. And what you can see here, again, the point is not for you to see the details of this, but this is the percent of successful agers that was reported in the 28 different studies. And you can see that it goes anywhere from 0.4% to 94%. That points out to the problem of, that depending on the definition, you can get a very different percentage of successful ager. And what I also like you to pay attention to is these 2 dark bars. Those are the bars that had asked the older adults to describe, indicate whether they were successfully aging or not. And you can see that the older adults' view of their successful aging is not the same as what the researchers are doing. They pretty much are, they are rating themselves much higher as successfully aging compared to the researchers. And you'll see in a minute why that will be the case. So in the study by Depi and Jeste, they identified the sources of variation in reporting successful aging. They said a lot of it had to do, obviously, with the definition that the researchers were using and its component, what component was included. Also, who were the unsuccessful agers group that they compared with. The negative control, in a way, had an impact on what you had, and also a bias toward studying negative outcomes, diseases and so forth, rather than some of the more positive outcomes that could be important in terms of successful aging. So given all of that, they found in terms of what components were strong predictors of successful aging, and they call them a strong support for a component to be a predictor of successful aging if it was reported in 75% of the studies that they reviewed. And from that, they found absence of arthritis, hearing problems, better activities of daily living, and not smoking to be strong predictors of successful aging. And some of these have been mentioned throughout the day by others as well. Moderate support, which is that it was reported in 50% of the papers they reviewed, was higher exercise and physical activity, better self-rated health, lower systolic blood pressure, fewer medical condition, global cognitive function, and absence of depression. And then limited support was found for having higher income, greater education, current marriage, and white ethnicity. I know David said that you thought having money was good, but I guess when they have looked at it in these studies, it didn't seem to matter as much as some of the other things. Although I'm sure having money would not hurt, I guess. So what they concluded from that was that it was prevention of disability and cognitive decline was very important in terms of successful aging, and that studies in their review offer evidence that health-related practices, for example, smoking and exercise, chronic illnesses, for example, diabetes and so forth, and the subjective healths are more robust predictors of successful aging than some of the demographic or socioeconomic factors. Now, another study by Peel et al. Looked at the association between baseline behavioral risk factors and the subsequent healthy aging in a cohort of people that were age 60 and over. And again, they did a literature review and selected 8 studies from 341 papers that had looked at the question of successful aging with a follow-up of 2 to 60 years. These studies mostly had Americans in them, with the exception of one that was conducted in Hawaii and used Hawaiians of Japanese ancestry, and they were all community older adults. When they did this review, they noticed that the definition of healthy or successful aging used in these studies ranged from primarily being biological, such as survival to old age, with absence of disability, to the comprehensive, such as sustained well-being using a bio-psychosocial model. So the definitions that are used in these studies were very varied. But despite the wide range of definitions that were used in these studies, majority of these studies emphasize that maintenance of functional independence as measured by ADLs or IDLs are very important in terms of successful aging. And they think, and given that these functions, these measures, look at sort of global functionality, both in terms of cognition and physical activity, it will make sense. Less frequently, these studies reported that high functioning in terms of physical performance, cognitive ability, or absence of disease and psychiatric mobility individually were less frequently cited as being related to healthy aging. So it seems that combination of these functions are needed, as captured in some of the other tests like ADL and IDL will be important to look at. So the indicators that they used within each of these domains to measure outcomes and the way that they were aggregated into score were very important in terms of the result of that the papers reported in terms of the percentage of people who were successful agers. So those are some of the difficulties that we're going to be facing in terms of coming up with the definition. Nevertheless, these are some of the behavioral determinants that they found associated with healthy aging: normal weight, physical activity, not smoking, moderate alcohol. I know that question was raised about alcohol, but moderate alcohol seems to be not a bad thing. Not being depressed, and more social contact was cited as being important in terms of healthy and active aging. Now, some of the more recent definition of successful aging have gone into putting more emphasis on social engagement, and not just, and the number of social engagements rather than just, being engaged with a group. How often and the type of social engagement seems to be important. And Young et al. Have sort of come up with these interlapping circles that will bring the physiological, the psychological, and sociological components of successful aging together. And there seems to be an emphasis put on engaging with life and spirituality and so forth. Again, these are some of the domains that are harder to objectively evaluate in terms of being able to look at the impact of interventions. But nevertheless, they are very important, because if you look at this, what this is looking at cognitive performance equivalent in years, and what you have with people that are 50 years or 80 years old. And this is looking at the number of social engagement. So this bar is limited social engagement, this is an average social engagement, and this is extensive social engagement. And as you can see, the ones who have extensive social engagement have much better cognitive function. More importantly, this gap becomes much wider as they grow older. So it seems like, the more social engagement that you have, the better in terms of cognitive function. And that actually was translated to reading that being connected to social groups had the effect of reducing cognitive age of an 80 years old by 9.5 years. So that's pretty significant. So Haslam, in a review, indicate that we no longer question the importance of social engagement, but it's what type of social engagement and the degree of it that is important in terms of successful aging. And the reason I emphasize this, as I was thinking about, is that how do we go about quantifying all of this and then determining the impact of intervention on them, because they're not as easy as before. So another way of looking at this is to try to talk about objective definitions and then subjective definition of successful aging. Objective definition of successful aging is mainly based on physical health that emphasizes outcomes that includes freedom from disability and diseases, whereas the subjective definition centers on well-being, social connectedness, and adaptation. And most older people do not meet the objective criteria for successful aging, while a majority of them will meet the subjective criteria for successful aging, and that I think is important. So this is from a study by Jesti et al. If you look at, for example, absence of diseases, only 15% of the older population that they looked at met that criteria. But if you look at something such as independence living, self-rated successful aging, life satisfaction, and et cetera, a larger proportion of older people will be meeting these criteria. And there is really a gulf between what older people identify as successful aging and what researchers will identify as successful aging. They usually, the researchers describe freedom from diseases and disability, and the older people themselves focus on adaptation, meaningfulness, and connection. So if you look at, for example, this is distribution of self-rated successful aging in older women, about 2,000 of them in a study by Jesti et al. You can see that majority of them rate themselves as successfully aging. But if the researchers were rating them, we might not have that high of a rating. So the question is, who should really define successful aging? Should it be the older people themselves, or should it be the health professionals or the researchers? And I suppose it depends on from what point of view. If you're trying to look at saving, healthcare costs, maybe it should be the researcher. But if you're looking at the pscho-social impact, then it is important to be looking at what the older people think about themselves. And this was very, very clear in the study that was done by Montrose, where 92% of community-dwelling older adults viewed themselves as aging successfully despite having chronic physical illnesses and some disability. And part of it is because these are some of the additional definitions that the older people include when they think about successful aging, which is not often included in our sort of objective way of looking at successful. I mean, how do you evaluate sense of humor, I guess? But that's something that is, important for the older people. And I do know that it's helpful for people to have sense of humor, and it helps them successfully aging. So it really points out to a need for research that we do need longitudinal studies of reliability and validity of subjective ratings of successful aging, in addition to some of the measures that we already have. So to conclude, I think over the last 50 years, the definition of successful aging has evolved from one that has been focused on the absence of diseases and disability that is more objectively determined and has a focus on negative outcomes, to one that includes psychosocial domains that are more subjective and reflect well-being from the point of view of the older adults. And while there is overlap among the different definitions of the healthy or successful aging proposed to date, there is also debate on which components are essential in terms of the definition and who should really define it. But regardless of all of that, it seems that high physical and cognitive and social function engagement is a common thread that is found among majority of the definitions. And while there is really good consensus on how to assess physical and cognitive health, it's more difficult to objectively define social function or engagement, and that's, I think, something that is lacking in the literature. Although which component, as to this morning was pointed out, which component of, for example, cognitive function you focus on, or which component of physical activity you look at, is going to have an impact on how the percentages are determined. So standardizing these measures is also going to be very helpful. And I do believe that a close collaboration between the biological and medical and social scientists is really needed in order to bring close some of these gaps, and whatever we do need to get the input from the older adults themselves, because they're the ones who are being impacted, and they certainly are important in terms of defining it. So another area that I think is in need of research is to better define early determinants or risk factors for key components of successful aging. And there's not a whole lot of agreement on this, but I thought this table was in the study by Reed et al. was helpful. And again, not to pay attention to all of the details, but what they did was compared their findings in the study of the Hawaiian men with three other studies that have been done in similar cohort. And the ones that I have highlighted the factors in terms of, and they looked at biological measures, they looked at health habits, baseline condition, and socio-demographic characteristics. And the two that I have highlighted in red are the ones that were identified in at least in majority of the study as being important for successful aging, and high blood pressure was one of them, and obesity, as has also been mentioned throughout the morning, another factor that comes out to be important in terms of predicting successful aging. The other factors such as serum glucose and diabetes, insulin resistance, as well as cigarette use and poor health or disease also are identified with less frequently as being important in terms of successful aging. And some of the other factors don't seem to be identified, although to be fair, they were not studied in all of the different the studies that are mentioned here, but at least we can identify a few that seem to be consistently coming out, which seems to be high blood pressure, obesity, cigarette use, and poor health and diseases. And with that, I want to finish. These are my parents, Mr. and Mrs. Nickby, my dad who just passed away at 98 years old. And I have to say, I would characterize him as successfully aging because he was healthy and doing everything himself, cognitively very sharp until a month before he passed away. So I think I'm trying to write a book about how he lived his life because I think it will tell us a lot about successful aging. And thank you very much. Be happy to answer any questions.